16 silent and deadly signs of fatty liver disease. In this video, I will show you 16 silent and deadly signs that may indicate liver problems, highlighting the importance of being aware of these indicators to prevent future complications. Many mistakenly believe that only excessive alcohol consumption damages the liver, when, in fact, a diet rich in processed foods, sweetened drinks, excess omega-6 rich vegetable oils, fast food, frequent use of certain medications, and viral infections also significantly contribute to this. This video will not only alert you about the risks, but will also offer tips for lifestyle changes and home remedies that have the superpower to reverse fatty liver and prevent further damage, highlighting the remarkable regenerative capacity of this vital organ. 16 silent and deadly signs of fatty liver disease. Let's get started. 1. Muscle weakness. Muscle weakness and muscle mass loss are concerning symptoms in individuals with liver issues, particularly in advanced stages of diseases like cirrhosis. These conditions stem from the liver's inability to properly metabolize nutrients and toxins, along with failure in synthesizing proteins, essential for the maintenance and growth of muscle tissue. Malnutrition, common in patients with chronic liver disease, exacerbates this scenario, as the body does not receive the necessary nutrients to sustain muscle mass. The reduction in protein synthesis by the weakened liver can also lead to a negative nitrogen balance, further contributing to muscle atrophy. Management includes nutritional interventions to ensure adequate calorie and protein intake, potentially in conjunction with medical supervised resistance exercises, aiming to minimize muscle mass loss and improve strength. 2. Light-colored stools. Light-colored stools may indicate liver problems, as this organ is responsible for releasing bile acids that give stools their typical brown color. When there's fatty liver disease or liver damage, bile flow can be disrupted, leading to lighter or clay-colored stools. Moreover, the presence of undigested fat in the stools can make them float in toilet water. This change in stool color and consistency serves as an early warning for liver-related health issues. 3. Fluid accumulation in legs and ankles, edema. Fluid accumulation in legs and ankles, known as edema, is a common sign of advanced liver problems, particularly associated with cirrhosis, where healthy liver tissue is replaced by scar tissue, preventing the organ from functioning properly. This symptom occurs due to the liver's decreased ability to produce albumin proteins, essential for keeping fluid inside the blood vessels. Without enough albumin, fluid accumulates in surrounding tissues, causing swelling. Additionally, cirrhosis can lead to portal hypertension, an increase in pressure within the venous system that carries blood to the liver. This additional pressure forces more fluid out of the blood vessels and into the interstitial spaces between cells, exacerbating the edema. Edema can range from mild to severe, and although initially manifesting in the ankles and legs due to gravity, can progress and spread to other parts of the body. Treatment focuses on the underlying liver problem, as well as measures to control symptoms, including salt restriction and diuretics to help eliminate excess fluid. Monitoring and treating edema is crucial, as it can improve the patient's quality of life and prevent complications. 4. Night blindness. Difficulty seeing in dimly lit environments, known as night blindness, can be indicative of a vitamin A or retinol deficiency. This issue is directly related to the liver's ability to absorb this essential vitamin for the rod cells in the eyes to adjust to different light intensities. Liver issues can disrupt this mechanism, resulting in a deficiency in vitamin A absorption and, consequently, in night blindness. This condition can also point to gallbladder problems, especially if accompanied by symptoms like dry, sore, irritated eyes, and a sandy sensation, suggesting a link between liver and gallbladder health and vision in low-light conditions. 5. Abdominal pain or discomfort. Symptoms of liver problems can include abdominal pain or discomfort, especially on the right side below the ribs, worsened after meals. This discomfort may be due to liver damage causing thickening of the bile, blocking the tubes connecting it to the gallbladder. Such blockage can create pressure, resulting in pain around the ribs and affecting the phrenic nerve. This, in turn, can lead to muscle tension and pain in the right shoulder area, potentially indicating a liver condition that requires medical attention. 6. Nausea and vomiting. Nausea and vomiting are common symptoms in people with liver problems, serving as early signs that something is amiss. These manifestations can be a direct result of the liver's reduced capacity to filter toxins from the blood. When toxins accumulate, they can affect the functioning of the brain and the digestive system, leading to a feeling of malaise and the urge to vomit. Furthermore, deteriorating liver function can interfere with the digestion of fats and other nutrients, causing gastrointestinal discomfort. Managing these symptoms is crucial for improving the patient's quality of life, involving dietary adjustments, medication to control nausea, and treatment of the underlying liver condition. 7. Itching in the palms of the hands and soles of the feet. Persistent itching in the palms of the hands and soles of the feet may indicate liver problems, occurring due to the buildup of bile acids under the skin, caused by inadequate filtration by the liver. This results in extra histamines in the bloodstream, causing itching. 8. White nails. Nails can reveal a lot about our health, and an example is nails that become completely white or take on a clubbed shape. These changes can be signs of serious health issues, such as significant liver damage. The loss of the natural pink color of the nails and the adoption of this bulbous shape can happen because the condition affects the body's ability to deliver oxygen to the nail matrix, the base of the nail. This observation is not new. As early as the 1950s, studies showed that a large majority of patients with severe liver scarring had white nails, highlighting how seemingly simple characteristics can indicate more complex health conditions. 9. Tendency to bruise or bleed easily. A tendency to bruise or bleed more easily is a telling sign of liver problems. This condition results from the liver's inability to produce essential proteins for blood clotting, such as clotting factors. When liver function is compromised, the body cannot synthesize these proteins effectively, increasing the risk of bleeding and making it harder to stop hemorrhages. This symptom not only indicates a possible underlying liver disease, but can also lead to serious complications if not properly monitored and treated, emphasizing the importance of careful medical evaluation and specific management for each case. 10. Changes in tongue color or bad breath. Changes in tongue color or bad breath can be less known, but revealing symptoms of liver problems. These oral manifestations reflect metabolic imbalances caused by an insufficiently functioning liver. When the liver fails to process and eliminate toxins properly, harmful substances can accumulate in the body, affecting various systems, including the digestive. This can lead to a change in the oral microbiome and the chemical composition of saliva, resulting in bad breath. Moreover, the tongue can take on a yellowish tint or appear whiter and pastier, reflecting internal changes. These oral signs are important indicators that a medical evaluation is necessary to investigate liver health. 11. Jaundiced skin. When the liver fails to filter bilirubin from the blood properly due to dysfunctions, the skin can take on a yellowish hue, a sign of jaundice, indicating possible serious liver damage such as hepatitis, cirrhosis, or intoxication by substances. This yellowing of the skin is an alert for the urgent need for specialized medical care, emphasizing the importance of consulting a doctor for proper diagnosis and treatment. 12. Dark urine. The color of urine can be an important indicator of our liver's health, as this organ plays a critical role in breaking down old red blood cells, releasing a pigment called bilirubin. When there's a problem with the liver or the gallbladder, bilirubin can accumulate in the body and be expelled through the urine, leading to a change in color to darker shades like orange, amber, brown, or even a cola-like tone. This occurs because the liver is not processing this pigment correctly. It's also worth noting that the use of certain medications, including antibiotics, sleeping pills, and contraceptives, can influence urine color, as these drugs can affect liver function, contributing to the observed discoloration. 13. Spider veins. Spider veins, which look like small red spots with branches similar to a spider, emerge when the liver does not adequately filter excess estrogen, resulting in damaged blood vessels. The increase in estrogen can weaken and dilate these vessels, causing the visible formation of these veins on the skin. If you notice this symptom, it is crucial to seek medical advice and consider undergoing an ultrasound examination for proper assessment and diagnosis. 14. Chronic fatigue. Chronic fatigue is a frequent and often debilitating symptom of liver problems, manifesting as persistent tiredness that is not relieved by rest. This type of fatigue can be indicative of liver disease because the liver plays a crucial role in regulating chemicals in the blood and removing toxins from the body. When the liver is compromised, toxins can accumulate in the blood, leading to a state of generalized malaise and fatigue. This symptom can significantly affect daily quality of life and well-being, making medical evaluation essential to identify and treat the underlying cause of liver dysfunction. 15. Changes in eye color. Changes in eye color can be a sign of liver problems, especially when they manifest in the form of jaundice, characterized by the yellowing of the sclera, the white part of the eye. This symptom occurs due to the accumulation of bilirubin in the blood, a yellow substance produced by the normal breakdown of red blood cells. When the liver is damaged or unable to process bilirubin efficiently, its level in the blood increases, causing jaundice. This is a clear sign that the hepatic system is stressed or compromised, requiring medical evaluation to determine the underlying cause and appropriate treatment. 16. Loss of appetite. Loss of appetite is a common symptom in individuals with liver problems, reflecting the organ's dysfunction in processing nutrients and toxins properly. When the liver cannot perform its normal metabolic functions, it can result in changes in metabolism and digestion, leading to a feeling of early satiety or disinterest in food. This symptom not only affects nutritional intake, compromising overall health, but can also be indicative of an underlying liver condition that requires medical attention. Proper management of this loss of appetite is crucial, potentially involving consultations with nutritionists to ensure adequate nutrition while treating the liver disease. How to reverse liver disease? As mentioned earlier, the liver undergoes 4 distinct stages of damage. Initially, it accumulates fat, followed by inflammation and the formation of scar tissue, known as fibrosis. In the most advanced and potentially fatal stage, it progresses to cirrhosis. Fortunately, there is hope, as the liver has the remarkable ability to regenerate and completely recover when you make improvements to your diet and employ appropriate remedies. So, let's go through the most important steps to reverse liver damage. 1. Engage in physical activity. Physical activity can help reverse fatty liver. Regular exercise increases insulin sensitivity and facilitates weight loss, 2 crucial factors in reducing accumulated fat in the liver. Additionally, physical activity can lower triglyceride levels and improve the lipid profile, reducing the risk of progression to more serious conditions such as non-alcoholic steatohepatitis, NASH, and cirrhosis. Therefore, incorporating aerobic exercises, resistance exercises, or a combination of both is recommended for the management and prevention of hepatic steatosis. 2. Improve your diet. Improve your diet by reducing the intake of sugary, starchy, and flour-based foods, such as bread, cookies, candies, ketchup, pancakes, pasta, and sodas. A fatty or damaged liver responds to fructose, which is the sugar found in fruits, much like it responds to alcohol. 3. Drink organic homemade coffee. Start your day with a cup of homemade organic coffee, adding a teaspoon of turmeric. The polyphenols in coffee and the phytonutrients in turmeric are effective in reducing the formation of scar tissue in the liver and promoting its repair from damage caused by alcohol, drugs, or fructose. Additionally, aim to consume at least 2 liters of high-quality mineral water throughout the day to help thin your blood and support the liver in producing bile to break down fatty deposits for enhanced toxin filtration. In your liver, consider adding freshly squeezed lemon or lime juice. 4. Incorporate bitter and sulfur-rich foods into your diet. Incorporate plenty of bitter and sulfur-rich foods into your diet. These include leafy greens, artichokes, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, pasture-raised eggs, wild salmon, oily fish, nuts, onions, scallions, and broccoli sprouts. Foods rich in sulfur can help reduce the accumulation of fat in your liver, boosting glutathione levels and supporting the detoxification of harmful substances. Thank you for watching. Don't forget to subscribe to the channel. See you in the next video.